We'll move then to special orders of business. 5A, Councilor Phillips.
Thank you, Mayor Bennett. So I am thrilled to introduce this motion. I move the motion introduced in the documents to a resolution declaring healthcare a fundamental right and supporting state and federal legislative action to achieve universal high-quality healthcare.
Second.
By Anderson. Okay, now, Councilor.
Thank you so much, Mayor Bennett. I really, as you can't tell, I'm really quite excited about this opportunity to testify or to submit this resolution in favor of declaring healthcare as a fundamental right. And I do remember what I wanted to say to Mr. Bravo, who spoke earlier, and to all of the people who submitted written or video testimony this evening, which is thank you, especially to Healthcare for All Oregon, who I worked with, as well as many other community groups and individuals throughout Salem to get what I think is a very strong resolution. As an emergency room doctor practicing healthcare in the busiest emergency room in the state of Oregon, I cannot tell you how many times I've seen people harmed by either the rationing of care or underinsurance or lack of coverage. I'm not saying that our system is foundationally flawed, but I think we all have to agree that we could do better. More people need better health care. And while some of the testimony tonight, was definitely very, very passionate, I'm not asking for any, specific fixes tonight, other than what's outlined in this resolution. I've tailored this to, speak to local things that are happening. So in the last legislative cycle, there was the passage of Senate Joint Resolution 12, which refers the question as a ballot initiative to the state of Oregon, which is that we'll be voting on whether or not we agree that healthcare is a fundamental right. And we're asking the city council weigh in on this and that we take the position that people should vote yes. It's changed over the years since it was introduced by Representative Greenlick, I believe. In the past, we're saying a fundamental right as opposed to just saying it's a human right. And we're making sure that we don't take away from our other constitutional obligations like education. Beyond that, we're stating our support for the state of Oregon to continue their work through past legislation on achieving true, universal coverage. The reason why I think this is so timely is Oregon was above the average. We got to 94% coverage in the state, but as a result of the pandemic and other, things that are happening as social determinants of care, we've slipped a bit and we've gone down to 92 or less percent. So there's continued work that needs to be done. And then finally, we're asking our federal delegation to keep working on achieving things like waivers that would allow states like Oregon, who are doing things that are more local and cutting edge, to get to that true 100% coverage, so that they can continue without running afoul of the CMS and criteria that exist at the federal level. So this is tailored to be local. It's not a specific prescription for how to get there. This is not an endorsement of Medicare for all. I mean, I might be supportive of single payer individually, but that's not what I'm asking City Council to weigh in on. I'm just saying that we agree with the words, healthcare is a fundamental right, and that we keep working to be better as a state in terms of providing healthcare for everybody.
If the recorder would please call the roll.
Councilor Phillips.
Enthusiastic, aye.
Councilor Leung.
Aye.
Councilor Gonzalez.
Aye.
Councilor Hoy.
Aye.
Councilor Nordyke.
Aye.
Councilor Lewis.
Aye.
Councilor Stapleton.
Aye.
Councilor Anderson.
Aye.
Mayor Bennett.
Aye. Motion passes.